The Food and Drug Administration is ready to approve the use of mix and match vaccines for boosters. Good afternoon, everyone, and welcome to 13 News at noon. The New York Times and the Washington Post are reporting that the FDA will give its approval for patients to get mix and match booster shots, regardless of which vaccine they originally received. The news comes on the heels of a National Institutes of Health report that showed Johnson & Johnson vaccine recipients saw antibody levels increase 76 times 15 days after receiving a Moderna booster shot. Now, an official announcement from the FDA could come as soon as tomorrow.
It will increase efficacy against severe disease. It will increase efficacy against all symptomatic COVID, and it will increase the breadth of the immune response against variants.
Now, the FDA has not recommended one shot over another, but has noted that using the same vaccine for a booster when possible is preferable. And Indiana just passed 1 million cases since the pandemic started. Now, the focus is on prevention and testing now more than ever since we're entering the fall and winter months. And when you break it down, about 1 in every 7 Hoosiers have had the virus. Right now, only 49% of Indiana's total population is fully vaccinated. That's well below the national average of 57%. But there is some good news. The numbers are trending down. You can see a steady drop from the recent peak early last month. If you look toward the right of your screen there, the number of people hospitalized with COVID-19 is also down, but the health department says 98% of those are not vaccinated. Now, the number of people dying with COVID is also falling after a spike in mid-September where an average of 40 people died every day. And the Marion County Public Health Department is now offering a 1-month supply of the QuickVue rapid COVID test to Indy residents who live in zip codes with high rates of COVID cases, lower vaccination rates, and high numbers of essential workers.
We're hoping that this may be a critical tool to identify those individuals who are unaware that they're infected, and so we can get them out of that social environment where they may be infecting others unknowingly.
The free kits can be mailed to your home by filling out an online form, or you can pick them up at 5 health department locations. Now, even though they are particularly vulnerable to the virus, only 5% of people ages 65 and up have gotten a COVID-19 booster shot. Now, the FDA has recommended booster doses for people who are most vulnerable, including that age group. Now, the push comes after the news that former Secretary of State Colin Powell died from COVID-19 complications. The 84-year-old was fully vaccinated but had a number of conditions that put him at a greater risk.